able to apply appropriate academic writing, conventions in written communication. So this is the one that we will do today, which you already have done in your previous assignments, but we will just touch and go a little bit on as to what we need to do in academic writing. Okay, so yes, I think by now everybody knows what is a professional development in health and social care. Last time we discussed the assignment as well. Your first topic will be about defining what is professional development in health and social care. So let me just slow down a little bit in what I saw in your assignments. Like a lot of people, what they still fail to understand is, if the question is about professional development, many of y'all have not given that detailed description, the starting introduction about defining what is professional development, right? Sometimes y'all write a lot about this, let's say, for example, risk assessment. Y'all will say risk assessment. Sometimes y'all don't even talk about risk assessment in healthcare sector. Some of y'all have mentioned in other corporate workplace. But y'all have to understand, student, this assignment is related to healthcare sector. So try to remember to bring the answer to healthcare sector and not any other workplace, not school, not corporate, not a HR department, but the healthcare sector. So if the question is about risk assessment, start by introducing what is risk assessment. Then start by how risk assessment is important in a healthcare sector. What are the dangers that can happen in a healthcare sector? Like that, you all need to always connect it to the to the question that is being asked, which is very, very important. Okay, so even the last week question, if it is we spoke about professional development, try to relate it to healthcare sector. Okay, and then of course all of you all by now know why professional development is important in health and social care. Again, in the assignment, don't just say professional development in a bank, professional development in a school. No, narrow it down, narrow your answer to healthcare sector. So you all know who are professionals in the healthcare sector: doctors, nurses, biomedical researchers. And then if these are the professionals in a healthcare sector, how do they behave? How do they talk? How do they control their body gestures? Like for example, if a female doctor and a male doctor have to work a lot of of course all of us, including me, we have always encountered working with a male colleague, or if a man has to work with a female, or a female has to work with a male. Usually, sometimes you can tend to have physical abuse or sexual harassment. But for me personally, in my life experience, I think I was fortunate. I had never had any bad experience when it came to working with any male colleague. That is actually a professional development, because even when I was working for clinical trial, the very, very first male colleague that I ever worked was with a older from Ruhuna. Like I told, he's the one who introduced me for my master's also. He and we had to literally be going to many places alone. We had to be alone, but never I had like any harassment, because we both like behave professionally, and even our organization knew that none of us had problem with each other. Only maybe issues came when it comes to sometimes there were ladies who had to take transportation in the night, because when you have to do patient visits, sometimes you have to go to the patient's house in the night, and then when coming back home, some of my work colleagues, they faced sexual harassment in transportation, but never in a workplace. Because in a workplace, before we call it an orientation, you will guide the employee and the employers how you need to conduct yourself when it comes to a female or a male colleague. And I told you also, it's the same thing. Like, for example, when I did the cardiology clinical trial, we have to do a ECG for the female. So when we do for a female, we have to do a breast examination, and for a male, we don't need to do that. But usually the radiologist was a man. So when he does it on a female, there should be at least two ladies need to be around him. Not because we don't trust him, but that is the protocol and ethics, because there is a female examination going on, right? So these are called professional development, right? How you behave professionally, how you talk. You can't talk to your colleague, your boss, in a way you talk to your mother, your father, your husband, your wife, your children, right? The way you communicate, I told you, is very important. Your tone, your, what do you call, your language, right? You need to be very professional. Like, even for example, like when I enter the class, when I teach, of course my students are like in 90s and 20s, so of course they have a lot of hormonal changes. The way they sit, sometimes it makes me very upset and angry, because I'm a teacher and I always expect a certain way of sitting, a certain way of talking. So I'm also very friendly, also very kind, but when it comes to the due respect, I'm very strict, because I know if I don't train them now, that is the same habit they're going to do it to another teacher, right? So that is why I say your professional development will start at a very young age. If you have started it at a very young age, it's very easy by the time you are an adult. Okay, so that is why you need to know professional development is important for an efficiency in workplace, for the security in workplace. If man and a woman can behave professionally, a woman will never feel like she is physically being threatened, emotionally being threatened, mentally being threatened. So for security, for efficiency, for productivity, for financial growth, right? For so many things, professional development is important in health and social care. So don't forget to emphasize on the word health and social care, right? And also we learned about activities that can be implemented for the development in health and social care. Again, please, if you all are requested to write in the exam, sorry, in your academic writing, try to emphasize these words: skills, capacity, capability, competence. You can interconnect it to this heading. Professional development is important, health and social care. You can say professional development is also about a person's skills, a person's capability, a person's competence, a person's productivity, right? And all this can lead to an organization or the healthcare sector's efficiency, security, financial growth, and patient maximum care, right? Or and best care for the patient. All that you can talk about, right? I will not go again into these details, because we already know about the activities we can implement to develop our health and social care. And also last time also you all told a lot about what are the barriers: lack of time, shortage of staff, IT, shift patterns, lack of funding. All these are barriers for professional development and health and social care. And we also learn how we could overcome this barrier. If you have a lack of time, what is your strategy? What is your plan? If you have a shortage of staff, what do you do? Right? If you have lack of IT skills, I already told you all, don't let anything to be an excuse. Yes, I told you we already have a lot of things going on in our lives, in our personal life. What happens today is not what is going to happen to us tomorrow. What happened to us this week is not what is going to happen to us week. අපි සාමාන්‍යයෙන් කියනවා කෙනෙක්ගේ ජීවිතේ දවසකින් වෙනස් වෙන්න පුළුවන්. අපි කියනවා මොහොතකින් වෙනස් වෙන්න පුළුවන්, right? That much life is unpredictable, right? අද හොඳට හිටියා, දන්නේම නැතිව කෙනෙක් පාරට ගියා, මොනවා හරි ඇක්සිඩන්ට් එකක් වුණා, එතනින් කෙනා නැති වුණා. Like life is always about, how to say, it's always unpredictable. You never know, right? That's why we always say ඕනම වෙලාවක කාත් එක්කවත් තරහෙන්වත් වෛරයෙන්වත් ඉන්න එපා, because you never know if you are going to die with in a very bad state. In a sense, if you are going to die with a grudge and anger and hate, අන්තිමට කවුද එතනින් දිනන්නේ, කවුරු දිනන්නේ, තමම තමයි එතනින් like you are the one who's going to lose, right? So anything, what I'm trying to say is, don't make anything as an excuse. If you lack a skill, try to attain that skill, develop that skill, right? Nothing is an excuse when it comes to lack of time or shortage of staff, and also anything, communication. So I will give you, because this is like my last lecture with you, I want to give you another very a take home message for all of you, because this is coming very much to a professional development. So I will tell you, in a staff that I work with 3 male colleagues and 2 female ladies. So I had to go to immigration on Monday. And when I had to go to immigration on Monday, I had to take my school day off and I had to go, like my workplace off, and I had to go. And then I am the one who has a lot of classes to teach, right? So when I had to leave, one male teacher, he's an African, he said, oh, why do you have to go on a day that you have high classes? Now we have to cover your classes, like that. Many things were told when he really didn't know what my situation was. I had to be in immigration, and because my situation was controlled by another secretary, when she asked me to join her, I had no choice but to join her. So the way he spoke to me in front of all the other colleagues really made me very upset, and it made me look like a person who is trying to escape from work, right? So after that, actually, I kept a grudge in my heart. And whenever he said good morning, good afternoon, how are you, when he offered me food, like I didn't respond. For 2 days, I didn't respond. And I think he understood that I was upset with him for something, but actually he didn't know what I was upset about, because I didn't go to talk about it at all. And then on after the third day, I actually decided that this is going to be an uncomfortable situation, because my character, my nature is, when I'm upset with somebody or someone, I cannot act. මට කවදාවත් රඟපාන්න බැහැ. මට මගේ හිතේ කියන්නේ කවුරුහරි මගේ හිත රිදෙව්වා නම්, මං ගැන වැරදි දෙයක් කියලා මං ඒක ගැන දැනගත්තා නම්, මට කවදාවත් ඒ කෙනාගේ I can never give eye contact and talk to that person ever again. This is my quality, my nature. Kene අපි කියනවා සිංහලෙන් අර දෙපත්කම් කවදාවත් I cannot do. I cannot have two faces. Like I hate him inside, but I will pretend like I don't have any issue with that person. I can never ever do that. That is a quality that I can never have in me. So what I decided was, on Wednesday morning, I decided before going to work, I will talk to this person in private, and I will tell him what is bothering me with his with his way of approaching my situation, when he really didn't know what my situation, and how it was unprofessional for him to talk about my decision in front of all the other work colleagues. So I actually, Wednesday morning when I went to work, I first of all said good morning, Mr. Alan, and he responded good morning, Miss Afrida. And then I said, can I talk to you outside for a few minutes? And he said, yes, of course. And we both went out, and I explained to him everything. I said, the way you handle the situation front of all my other work colleagues was not a professional thing. When you didn't know what my situation was, how can you suggest, and what is the right you have to tell me what I should do and what I should not do? I told him very directly, and he was very upset, and he was very he was very actually very surprised that actually that I took it to that extent. And then he understood I had a point, that I was very fair to be upset about it. Then he apologized to me 2 times. And I said, Mr. Alan, if I don't resolve this issue with you, I can never talk to you in the staff room, because I will feel very uncomfortable until that situation is resolved. And then he said, you are a very courageous person to come and directly tell me what was bothering you. So like students, I always Mama හැමතිස්සම දේශනා දෙනවා, right? I always preach about my personal things, my experience. So I also realize as a lecturer online, I have already told you all about this. හැමතිස්සම මම කියලා තියෙනවා, ප්‍රශ්නයක් තියෙනවා නම් ඒ කෙනාට කියන්න. අනිත් අයට ඒක ගැන කියන්න යන්න එපා. Directly go and tell to the person whom you have that issue with, rather than gossiping about that person to other people. And after that, he apologized. I forgave. Now the issue is over. Now things are back to normal. That is why I say, when it comes to barriers, communication is one big barrier, right? How you communicate. And other thing is, especially now, I told you last time also, this 21st era is all about text messages, chat, right? Email එක වුණත්, I think professional, but even in email will not be able to take a good idea. Always better to talk one to one, especially like if if you all have a problem in conversing in English, right, or conveying the message in a proper English and making them to understand, is always better to go face to face. Maybe if you have to talk it in your own language, talk it out, resolve it then and there. These are what you call professional development, right? Especially how you handle people, how you convey a message, and how you talk to them is a very important thing, right? And I also realize as we grow older, I think when we were teenagers and when we were in our 20s, Samani, like we tend to talk a lot. Hamom ape yalu. Like everybody is our friend. But you understand, as we grow older, at least for me, compared to what I was in university, in my workplace, I don't consider anybody my friend anymore. Because I already told you all, in your workplace, nobody is your friend. Do you all agree with me on this, students? Rifka, Janaka, Taranga, do you all agree that in your workplace, you only have colleagues but not friends? Do you all agree with me on this? Yes or no? Maybe one good friend might be there, but if you take 95% or 99%, what do you all think? Can you think a work colleague can be a friend or just a colleague? What do you think?
Just a colleague, man.
No, no, it is
Yes.
not professional then.
Yes, exactly. Exactly. I also think so, right? Because I can tell you personally
We
in
can
my work,
maintain friendship out of the work, but not in a workplace.
we're not definitely, because I will tell your students how much I am surprised. Like sometimes දැන් අපි කියනවා සාමාන්‍ය ගෑනු තමා ගොඩක්ම gossip කරන්න කියලා. Like we say women gossip a lot, right? For me, I was so surprised how much men gossip with another man about work colleagues who have left in the past. Now I have joined the organized this workplace. It's been around 3 months, right? Still I'm under my probation. But how two men in my workplace talk about so many people who have already left. Why do we need it? Is this professional? But because they are like in their 37, 40, and they're like way older than me, I don't want to stop and correct. So what I do is I take my things and now I go to a very quiet place to do my work. Because one thing I want to tell you all is there is a sector of people, they don't gossip, but they like to listen to all the gossip. There's another set of people who listen and also contribute to the gossip. These are both actually very unprofessional. Like in my religion, if you are equally listening to the gossip is also a sin. If you are gossiping also, it's a sin. This is what Islam and I think Buddhism or any religion strongly will encourage. Don't talk ill about people. තවත් කෙනෙක් ගැන වැරදි කතා කරන්න එපා. පුළුවන් තරම් you try to be, if තමන්ගේ වැඩක් බලාගෙන ඒ කියන්නේ you need to go on to be professional, right? So that is what I'm saying. So it was very like I was so shocked. ආයතනයක නැති කෙනෙක් ගැන ඇයි ඔය තරම් කියවන්නේ? Why do you talk about a person who is not in the organization anymore? What does it serve? ඒ වෙලාවට පොතක් කියවන්න, ඒ වෙලාවකට එක course එකක් online කරන්න, කොච්චර වැඩ කරන්න පුළුවන්ද, right? That is all professional development. So like that is one thing I like to go outside the world, because අපි හිතනවා ජීවිතේ like we are finished after we learn things. No, there are so many things you learn about people. You learn about how much the way they behave. That's what I said, the way you talk, the way you treat, the way you communicate, your body gestures, right? They all make you a professional. Honestly, it makes you a professional. Now, don't ever think just because you're a doctor, I'm a professional. No, well, it's wrong. There are doctors. I told you, I worked in NHSL. I have dealt with really arrogant හරිම උඩඟු consultants අත් එක්ක මම වැඩ කරලා තියෙනවා. කිසිම patients වට ආදරයක් නැති, කරුණාවෙන් කතා කරන්නේ නැති, තමන්ගේ පදවිය නිසා තමන්ගේ උඩඟුකම පෙන්නන මිනිස්සු අනන්තවත් I met in my NHSL as a researcher in NHSL hospital, right? Never. For me, I'll tell you, not being down to earth, not showing kindness and empathy is also being unprofessional. Definitely, because I think all have learned with Miss Ganguly or Miss Tammy, caring profession means how kindness, what love and what caring you show them is also a professional way, communication, right? So that is, you can add all these into your assignments, guys, okay? And then when you talk about different sources available for professional development, again, I told you this slide you will need to remember, like research, your job performance, like duties and responsibilities. You go for education, you go for work, conferences, so many things, right? And then also this slide was also there. I think today we will learn for this question. That's why I'm going through this slide. For example, what are your goals and targets for a professional development plan, right? I already told you we have now coming to the end of this, we are in November. We have 1.5 more months, and then we are finishing 2022, right? The year flew very fast. But I know so confidently, every one of y'all who joined this course, right? I am very strong that all of you all have gained a skill. You all have gained maybe a skill in how you all are thinking, right? Forget about assignments. ඔගලන් හිතන විදිය වෙනස් වෙන්නේ නැති. ඔගලන් මිනිස්සුන්ට කතා කරන විදිය වෙනස් වෙන්නේ නැති. The way you all write, the way you all communicate, maybe ඔගලන්ගේ confidence maybe have gone up. Those are all skills, right? Maybe you all have better time management. පැය භාගයකින් can if you all are taking something 30 minutes more, maybe now you all have trained yourself to do something extra 30 minutes before, right? These are all skills. So that is why we call it reflection. So I want, if you all can do for me also, like when I come after work, I always reflect. Did I talk too much? Did I share too much? Did I get angry too much? How would I handle the situation better? How would I handle this student better? How would I handle this colleague better? I always reflect before I go to bed. As a person, my weaknesses, my strengths, everything. You can have daily reflection, weekly reflection, monthly reflection, yearly reflection. Have it before end of 31st of December. You could have realized, අපි සාමාන්‍යයෙන් කියනවා දවසකින් අපිට වෙනස් වෙන දේ අපිට තේරෙන්නේ නැහැ. හැබැයි අවුරුද්දක් අග වෙනකොට අපිට හිතා ගන්න පුළුවන් කොච්චර දේවල් වෙනස් වුණාද කියලා. Like අපේම, like our body has changed. You know, how the way of our thinking has changed, you know, like a lot of things change, right? If you go back 12 months. But when you do the routine every day, you don't feel like there are many changes that is happening. That is life. But when you go right to the end of the year and when you reflect back, you will see so many things have changed. Maybe the mistakes you have made, maybe the lessons you learn, maybe the strength you gain, maybe the courage you gain, right? The bravery, all those things, okay? Right. And most of you all told me last time also, you all told me about the benchmark, the standard. When it comes to a product, you will go usually to an ISO or SLS. But when it comes to a human, you will go in terms of how their work ethic is, how they treat people, right? It's mostly with patients, with nurses, with doctors. So please, please don't forget to narrow it down to the healthcare sector, right? And also, this is a very important thing I said. Last week also we said 99% of us are not completely happy in what we are doing. Taranga said, even if you are an entrepreneur, even if you're doing something of your own, you will not have 100% satisfaction in what you are doing. Therefore, we suggest you to go to keep going. What are the things you could do? Maybe lunch break, coffee break, gym, hang out with your friend. Like even for me, I will tell you, like when I look back, sometimes I break down. And then how at my age to do so many things on my own, go away from family, go away from loved ones, do so many complicated things on my own. And now I have to be on my own for some time, go to work, come alone. And it sometimes is a little bit difficult for me. And like I said, a lot of my friends, they always say, Afrida, we cannot do the things that you're doing. I don't think I would ever manage it to do something so much alone in another unknown country. And today, actually, even today, I felt it. I felt because I don't think everybody can do it. And just because everybody cannot do doesn't mean that they are not weak. That doesn't mean they are weak or not brave. Sometimes it is a matter of people getting different courages. සමහර අයට ඒ කියන්නේ ජීවිතේ හැමෝටම there is a testing phase. There is always a way that people will gain their courage. Every one of us, right? So there is another thing that I must add is when it comes to professional development, one of the best things that we can do is how we control our emotions, right? How we control our anger, our feelings, right? The very most important thing. If you go to see, 99% of the time is our psychology, right? It's all about our psychology when it comes to professional development. If your psychology and if your mentality is strong, automatically your physical setup is going to be strong. Most of the time, Hitana, someone has lost their loved one, lost their job, financial crisis. May hammer them if you go to see where does it really lead to? An emotional weight. It goes to a psychological mental burden. And ඊට පස්සේ මොකද්ද වෙන්නේ සමහර අය ස්ට්‍රෙස් එක නිසා they tend to consume alcohol, sometimes smoking, sometimes overeating, sometimes not eating at all, right? Sometimes they go into different kinds of addiction just so that they can forget about everything. And what happens, all these addictions are physical, but if you go to see the root cause is mental. So professional development actually is a development that has to happen a lot psychologically. So if you go to see this lunch, coffee, interest group, healthy meal, may occur giving a person mental sort of strength to get up every day and go to work even if you feel like not doing it. You understand, student, what I'm trying to say here? Rifka, is it clear? Taranga?
Yes, ma'am.
Okay.
Yes,
And
ma'am.
then, of course, okay, relevant courses, shadow another department, find a mentor. All these will be, these 9 factors will be how you can improve your professional development pathway, right? All these you can write it in your assignment, right? And then this also this is where we stopped last week. For example, how do you set professional development goal? Please don't forget these words: specific, measurable, achievable, relevant, and time bound. But before you write these answers, please mention always, like I said, have a brief introduction to that question and then give the answer. Like for example, simply mama kiyanawa na, talk about how diabetes can cause, let's say, how diabetes can cause a person to lose weight fast. Don't directly say diabetes will make a person to lose weight fast by making muscle wastage. එහෙම කියන්න එපා. Start by diabetes is a disease caused due to uncontrolled sugar. Diabetes is of 2 types, type 1, type 2. Diabetes can be caused due to these particular factors. Then you come to the question, how diabetes can make a person to lose weight. This is what I saw in a lot of people, whoever the ones that I read in the assignments. අර ප්‍රශ්නෙට කියන්නේ ඉන්ට්‍රොඩක්ෂන් එකක් දෙන්න නැතුව කෙලින්ම යනවා උත්තරේට. එහෙම කරන්න එපා. එක්කෝ if it's not that, the other one is although narrow it to the healthcare sector. ගොඩාක් දැන් I don't know කවුරු හරි ලිව්වා primates and non primates ගැන. I think it's okay, I will not mention name, I don't think it's correct, but I mean primates, non primates ගැන ඕනේ නැහැ. Like non primates ගැන like සත්තු ගැන you all have mentioned in the assignment. Hey, why do you need to mention about the animals? No need, because we are talking about healthcare sector, right? Healthcare sector, who are the ones? We are not talking about a veterinary or a animal department. We are talking mainly about who? Patients, right? Children or elderly people or old people, right? එතකොට ඒගොල්ලන් ගැන කියන්න. Don't talk about animals or other unrelated population of people, right? So that is why, like I said, මම කොච්චර සමහරවට කීප පාරක්ම එකම දේ emphasize කරත් අර same mistake එක repeat වෙනවා assignments වල. ඒකයි මට පොඩක් concern වුනේ. ප්‍රශ්නයක් නැහැ, because I know, I understand it's your first time, but at least now මං කියන දේ ගොඩක් අදවත් අකනා, because last class එක හොඳට attention දීලා අහගෙන ඉන්න, because this can be really useful for your next assignment, right? So just be very attentive. So when you are setting professional development goal, try to make sure to be specific as possible, measurable as possible, achievable, relevant, and time bound. So these are very, very important, right? And then how to create a personal development plan in health and social care. So this also we spoke, right? All of us, we will feel, like I said, bogged out, or you will feel work. Then සමහර වෙලාවට ලොකු නිවාඩුවක් ගන්න, like sometimes I will say, personally for me, we do so much of work and then finally we go for a break, right? And we are resting our body, our mind, everything. Another struggle is coming back again to work after that break. Have you all gone through that struggle? ඒ කියන්නේ break එකක් ගත්තට පස්සේ ආයි momentum එකක්වත් motivation එකක්වත් නැහැ. අර පරණ විදියට work එක නිකන් අර with stamina වලින් කරන්න. How many of you all have faced that kind of situation? Not having the motivation, not having the what do you call it, enthusiasm. Have you all ever gone through like that after a break, after a vacation? Janaka, Taranga, ඔගොල්ලන්ගේ අවුරුදු holidays වලින්
Yes.
පස්සේ you all have gone through. Yes. What do you do, Rivka? When you have holiday, you call it holiday blues. Make a samanya, you have it Sunday blues. Have you all felt this depressing phase Sunday nights? Sunday at 7 p.m., 8 p.m. එනකොට නිකන් මාර dull ගතියක් වගේ. Have you all gone through this phase usually?
Yes.
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 Yes, yes, we all go through this. We call it the Sunday blues. Students, lecturers, doctors, every one of us, we go through this Sunday blues, or we call it holiday blues, right? This is very normal, right? Now, what happens is sometimes we feel after we take a good vacation, we are going to feel energetic and we are going to be more productive to go back to work. But actually, it's not the truth. We are going to go in the opposite direction. Now, in these situations, as professionals, what you can do is start by writing a plan. Like, let's say Sunday night, Monday, you need to do a lot of things. Like I said, write down 5 main important things that you need to finish by Monday night or Monday afternoon. You do one task early Monday morning, might feel very hard, but you just say, okay, I will start the timer just for 30 minutes. Once I finish it, I will stop the timer for 30 minutes, and then I will take maybe a small coffee break, and you finish it, and automatically you get the, what do you call again, the enthusiasm or the motivation to go to the task number 2. So සමහර වෙලාවට professional development, you need to take control of your own psychology, your own mind, how you trick yourself to do something better, right? That is why this whole planning is very important. So this can come because of stress, busy schedule, or it can happen because of overly resting, vacation mode, anything. But how you make a personal development plan or a professional development plan is always about writing it down and then you breaking it to small pieces by pieces. අපි කියනවා, you eat the elephant into small pieces. When you have a lot of things to do, you break it into smaller and smaller pieces so that eventually you get it done one by one. එක වඩක් ඉවර වෙනකොට, I am happy that is over. Then you get the energy to do the next one. Before you know, all the 5 tasks you assigned for Monday is completed, right? That is a good professional way to have a plan. And like I said, if you do that way, you can accomplish a lot of things. You know your goals, you can improve your performance. And one of the biggest thing that you will improve is your motivation, your progress, your purpose, right? ඇත්තටම ගොඩක් අය, one thing they are suffering with a lot of thing is this word. හැමෝම අදටත් සාමාන්‍යයෙන් අපි කියනවා, when you finish your university, you will know your purpose. ඇත්තටම students, I will tell you, there are 50-year-olds to this day who don't know what their life purpose is about. Because අපි කියන්නේ අද ජීවිතේ or අද තාක්ෂණයත් එක්ක අද හැමෝම යන්නේ නිකන් රොබෝස්ලා වගේ. Like I told this last week also. හැමෝම යන සමහර අය තමන් යන ගමනවත් දන්නේ අර what do you call අර crowd එකක් එක direction එකක යන නිසා අනිත් අයත් නිකන් අර ඔහේ follow කරනවා. දන්නේ නැහැ ඉදිරිය මොකද obstacles ඇති කියලා. Nothing, don't know. But because it's a big crowd following in one direction, they feel that they also need to go in that. පස්සේ ගිහිලා අතරමඟ තමයි දැනගන්නේ ඇත්තටම why did I take this journey? I am actually in the wrong track, right? So this is a problem for most of the people, right? What is your purpose? Like for me also, if I try to do like for example, I told you almost around 4 or 5 of my friends went to do PhD, right? To get the doctorate. Now, if I also feel like I should get a doctorate simply because my friends did, I don't think I am doing the right thing, right? I don't think I am doing the right thing. I will tell you all the difficult thing about what do you call having friends in universities ගොඩාක් වෙලාවට අපි ජීවිතය compare කරනවා ඒගොල්ලන්ත් එක්ක. දැන් ඒගොල්ලන් මේක කරනවා නම් මමත් ඒක කරන්න මටත් I also should be doing that. Because if I'm not doing what they are doing, maybe I am a failure, they are a winner. No, this is also professional development. The positive self-talk that you give yourself, right, is also a professional development. So you need to find your sense of purpose. Can you all tell me what is the main word that we use when it comes to finding your sense of purpose? It's related to the mind. Can you all remember what and very related to Buddhism? Can you all tell me what is that? Someone? To know your sense of purpose, මොකක්ද ඔයගොල්ලන් සාමාන්‍යයෙන් කරන්නේ? Can somebody tell me? What do you to improve your sense of purpose? What is it that one thing that you will encourage yourself to do? Can somebody tell me? Rifka? Taranga? It starts with M.
Meditation.
No, not meditation. Something closer. Mindfulness. Do you remember that word? Mindfulness?
Yeah.
Yes, that is a very important word, right? You need to have self-awareness and mindfulness, because when you go through that, you will tend to know your sense of purpose, right? සමහර වෙලාවට දැන් ගොඩාක් අය, right? Like I tell you, I know a lot of people who are lawyers, right? කාලයක් යනකොට ඒගොල්ලන් මේ profession එක කෙලින්ම අතාරිනවා. They don't want to be a lawyer, like good top-notch lawyers, because ඒගොල්ලන් කියනවා ඒ profession එක ගොඩාක් බොරු කියන profession එකක්, පව් සිද්ධ වෙන profession එකක්. සමහර වෙලාවට කෙනා වැරදි කරත් ඒ lawyer hire කරනවා එයාගේ වැරදි හංගලා එයාව හොඳ පුද්ගලෙක් විදිහට පෙන්නලා, because සල්ලි වලට ඒගොල්ලන් hire කරනවා. That's why you hire a lawyer on behalf of a murderer, and the lawyer will defend the murderer with terms of lies, right? And then after some time they find that the purpose is ඇත්තටම මම කරන දේ හරිද වැරදිද. I'm not saying all lawyers are like that. There are lawyers that are really like they can, it's up to you. You can decide whether you will take up the case. If you actually have to defend a person who has really suffered, you are the one who are going to really save the victim. Yes, it's a very rewarding profession. Lawyers can always select their case. I'm not saying all lawyers are bad, but I'm just saying I know many people who are lawyers, law faculty ගියපු අය, they end up becoming lecturers or they go into a teaching profession. Because for me, ඕනම දෙයක් doctor කෙනෙක් හරි එකයි කියන්නේ healthcare sector හරි හැමතිස්සෙම බලන්න ඔයගලන්ගේ profession එක, is it something just as much as is rewarding you, see if it is rewarding the society also. That is very important, because sense of purpose will hit you at the age of 40 and 50. As you age, a lot of people will question your existence. That is very normal. අපි වයසේ යනකොට දේවල් complicated වෙනවා, එතකොට you will question your existence. So mindfulness is always important. Your goals, your self-awareness, your personal growth, and also how you organize your time better. All these 4 factors can give you a clear sense of purpose in life, right? And reflective practice, again, very important. Write, students, write. At least once a week, Friday night or Sunday night, once a week, sit and write what happened to you all within that week. What did you all learn? What did you all accomplish? What did you all, how did people let you down? සමහර වෙලාවට now ගොඩාක් වෙලාවට we are good people, but society, I will tell you, when I was in school, teachers are ගොඩාක් කිව්වා ළමයි ඔයගලන් 19න් පස්සේ you all are going to actually the most dangerous zone in life. And at that time I remember that advice, and they said, you all are now in school, you all are in the most protective zone, because we are taking care of you, your parents are taking care of you, and you are in the most safest zone life could offer you right now. And I think I cannot deny that advice. To this day, I realize how much what they said was so true. And when I was teaching in Sri Lanka to my students, now they're all in university in the UK. Now they are messaging me back and telling me, Safrida, the advice that you gave us during school is so true, Miss, because we are facing a lot of challenges now. Now they are 19 years. They will be turning 20 next year. And they are saying now they are finding new, hunting for rooms in the UK, trying to do part-time jobs, trying to manage the job. Sometimes parents are sending money, they are feeling bad about it. And I said, your life struggle will start at 20. Of course, some children also go through, like in the crisis of Sri Lanka, whatever we didn't go through, they had to go through a lot of things. I'm not just saying, but I'm just saying in a standard state, life struggles will start a lot right after you exit from the school, right? A lot of challenges. So that's why reflection is very important. Like for me, when I reflect back, like I told you, if I'm going through a challenge now, reflection is if I feel I had a similar challenge and when I got through, I realized, okay, I had the courage then to go through it. I will have the courage again to go through it now. That is reflection, right? So again, what are the benefits? Mindfulness, continuous improvement, emotions and empathy. One of the most important thing, right? When you reflect, you will tend to bring your focus to one point. අපි ඕනම දෙයක අපි කියනවා continuous improvement. කවදාවත්, even a surgeon who is a consultant, even for example a principal who is in the highest position can never tell, okay, I am in the highest position, so there is nothing to improve in myself. No, every second, including myself, I have learned a lot from your experiences. You all shared a lot of things and it helped me, right? Everybody have to have a continuous improvement. Api ekata kiyanama attitude. The attitude is you must always feel I have more room to learn, more room to improve. Okay, that is continuous improvement. And you have to connect with people, emotions, and empathy. Like for example, batch 2, I don't feel any connection because I don't know whether they are here, whether they are not here, whether they are muted, unmuted, or whether they are even listening. I don't know because I cannot connect if there is no emotions, right? So emotionally, you have to connect with somebody, listening, contributing, giving your opinion, giving your views and idea. They are all emotions, okay? And this one also you can say, for example, if you are going to do your assignments, you need to, like, let's say you read the first question of the assignment number 2. You need to read. එතන parts 4ක් තියෙනවා. Okay, ඔගලන් parts දෙකක් කරා. කරාට පස්සේ you need to now understand on yourself. Take a small break, okay? Break එක ගත්තට පස්සේ හිතන්න, okay, what do I need to complete now? I have 2 more questions I need to complete. Then you need to now maybe, once I send the feedback, maybe you all will understand, maybe if you all are going to the next diploma level, what did I do last assignments? What was my problem? What was my mistake? Was it the spellings? Was it the grammar? Was it not answering to the question, right? What did I do? Reflection. How could I have done better, right? Again, like I said, read the question very well, define for the question that has been asked, then give examples, then give elaboration, right? That is what you need to do better, right? So reflective practices, we learned about continuing professional development. Reflective practices will help you to professionally continuously develop yourself, right? That is what it does. And you can even add this diagram. So the summary of everything is this: reflect, plan, do, and record. And remember, not just in healthcare sector, this cycle, මේ චක්‍රය ඕනම වෙලා, any situation in your life is applicable. You reflect, you plan, you do, you record, you reflect. I think 3 weeks ago, you all gave me an individual example. So for example, I will give you all to remind again, if I have to deliver a lesson today on, let's say, heart, right? Hardaya Gana. I will plan the lesson, then I will do the lesson, like I will explain what is the heart, what does the heart do, what is the importance of a human heart. I just do the lesson. There will be few students who have missed it. Therefore, I record the lesson so that they can watch the recording after this lesson or maybe next week. And then as a lecturer, I reflect, okay, if I'm teaching about the heart, maybe it would have been better to show them an actual model of the heart. Or maybe I can show a dissection. How to cut the heart, how to identify the hard part. And as students, what would you reflect? Okay, maybe I didn't understand what the teacher was saying or the lecturer was saying. I need to maybe ask then and there when I didn't understand, or I will WhatsApp my question, or maybe you reflect. Okay, reflection is two ways, for the teacher and also for the student. So this is a cycle, right? Of course, advantage of reflective practices, we already know. Your scientific knowledge will improve, your professional responsibility will improve, your career pathway will improve, your prospects, your progress, everything, right? Yes, like for example, when you are the role of a reflection outcome based continuous professional development, you have to plan. What is it? Okay, what do I do now? What do I do next? Right? These are the questions that you could ask. It's all in the slides. I will not go in detail, right? And tools for self-assessment. This also you can put in your exam, in your assignment. Like for example, if I give you this assignment here, okay? Give me a second. Yes, this question, right? Yeah. Describe how you would apply reflective practice techniques to improve your own performance. So for that, students, you can use this slide number. Tools for self-assessment. You can start from reflective practices. You can talk about these 4 points. And also you can talk about the advantage of reflective practices. And then you can talk about the stages. It has planning. In those planning, what are the questions you could ask, right? And these are the tools that you can do, right? All those things you can talk about. Like for example, here it says skill evaluation checklist. For example, let's say the skill that you are trying to improve is speaking in English, right? You will have very good, good, poor, and weak, something like that, right? So what happened? First month, you are not so good. 3 months, you are getting better. By the end of the year, you are excellent. So you can have an evaluation checklist based on the skill that you are trying to improve, right? And then, for example, SWOT analysis, right? It's an analysis of, like SWOT means like it's you actually, again, it's a self-assessment tool, right? Where you will see your strength, your weaknesses, like for example, your habit, work habit. Are you someone who goes to work very late and then you leave work very early? They are bad work habits. Or are you someone who gossips a lot about other people? Tell one things about this colleague to another colleague, this colleague. No, don't do that. Actually, you realize, like I told you, කවුරු හරි තමන් තවත් කෙනෙක් ගැන දෙයක් උගලන්ට ඇවිල්ලා කියනවා නම් don't judge the person that they are talking about. Judge the person who is gossiping that information. Actually, for me, this is the most best thing that you should give. If somebody is bringing some nonsensical information, කියන්නේ ඔයාට ඒ කෙනා වැරදි කළා නැත්තම් හරි ඔයාට කිසිම අදාළත්වයක් නැත්නම් කවුරු හරි ගැන මොනවා හරි ඕපදූපයක් ගේනවා නම් ඔයා කියන්න කෙලින්ම you directly tell, excuse me, I am not judging the person you're talking about, but I will judge you because you are bringing gossip to me. Really, that is what you should, this has to stop. I think I am now gonna start this from all my students because I want this, what do you call this ritual to stop now. This talking about people is a very disturbing thing. Because I realize so much is going on in the world when people are dying with hunger and poverty and so many crises and health problem. I honestly don't understand why people have so much time to talk about other people, right? So when it comes to work habits, why I say this is 99% of the time, the work habit that has made people to really suffer is one thing is this gossip, asking about people's personal information, then talking about that to other people. Why do you want it? Unnecessary, right? So work habit, you need to know if it is a strong work habit or a weak work habit. Professional development plan, again, needs to have a structured plan. Like අපි හිතමු, Janaka is a manager. He has to take it to his maybe higher superior, general manager, or to the CEO. he has a board meeting and he has staff that he has to present a plan about his tea factory or whatever it is. He can't just go without a PowerPoint, tell the people to come for the meeting at 8 a.m. Yeah, he has to make a proper professional plan. Okay, he makes an agenda. Today's meeting, 8 o'clock, I will talk about introduction. 8:15, the topic will be of this. 15 minutes, you will have a tea break and we will sum up this. Professional development plan. Anytime, remember, like as a lecturer or as a manager or as anyone, if you have to deliver a lesson or a presentation or a conference or a seminar, always have the agenda to your crowd, to your people who is going to listen to you or who is going to watch you. Because every time, remember, somebody who participates a seminar or a conference, හැමෝම කැමති අපි මොකක්ද ඉස්සරහා මහන්නේ මේක කොච්චර වෙලාවකද යන ප්‍රෝග්‍රෑම් එකක්ද මොන මේ කියන්නේ when does it finish දන්නවද මේක මේ මොන වෙලාවටද ඉවර වෙන්නේ කියලා. ඒක තමයි සාමාන්‍ය මිනිස්සුන්ගේ අපි කියන curiosity. Because time is something important for all of us, because that person may have to go and pick up the child, maybe they have a hospital appointment, maybe some personal thing, but still they want to be in the meeting and conference. So it is always good to have a plan with your agenda. What time does it start? What time does it end? If it is a 1 hour program, jot down that 1 hour, break down and show in that 1 hour what and what you are going to do. If it is 2 hour, break down. First 20 minutes, it is this topic. Next 20 minutes, it is this topic. Lunch break, tea break, and final conclusion and vote of thanks. Right. That is development plan. That is all professional. Like I said, I am learning so much as well. My workplace in Sri Lanka, what I learned, I will be very honest, I have gained a lot. As a Sri Lankan, I would say, I'm honest, like I said, don't ever think because I'm in another country, I have forgotten my country or what I gained. No, that is not true. Somebody was telling, another Filipino work colleague was saying, now her father is very sick, so she has to go to the Philippines, and she's actually a lot of fear because of all the robbery that is taking place in the Philippine airport. I told openly to everybody, oh my God, in that aspect, Sri Lanka, I have never gone through any issue where my things have been stolen in the custom or things have been stolen here or there in the airport. That way, my country is a gem. True. It's a truth that I have to mention. I have never, when it comes to security level, of course, I have been discriminated as a Muslim. Right after the Easter attack, I had gone through a lot of severe checkups, right? Because that 2019 was the time I had to leave Sri Lanka to go to Bangkok for my MSc because of my scholarship. And that time the security was very, very strong. And because I was a Muslim, they took a lot of, a lot of extra checking, right? Because what few people, when they do bad things, it goes bad to the entire people. That is a normal nature, right? That is normal, but it's a wrong way of thinking and seeing because not everybody is like that, right? Anyways, but what I'm trying to say is, I am so grateful of my work experience that I got in Sri Lanka is very different, but has helped me a lot to survive certain things in Bangkok, right? That is why I want to tell you, හැමදාම professional development එකේ එකම circle මිනිස්සු තියාගන්නත් එපා. You have your friends as your school friends, your university friends, but don't all try to like go out a little bit to see other kinds of places, to have more experience. නැත්තම් කවදාවත් අර අපි last week අපි කිව්වා comfort zone. සමහර අය හරි බයයි අනිත් අයත් එක්ක වැඩ කරන්න. ඒගොල්ලන් කැමති තමන් පුරුදු අයත් එක්කම වැඩ කරන්න because they feel, I understand, even I also have this problem, especially when it comes to working with other people. ඒ වගේ challenge එකක් කොහෙවත් නැහැ. To know that person is going to be a good person to work with, that is a biggest fear. But at the same time, if you stay in that comfort zone of only wanting to work with easy people, you will not grow your mind how to handle difficult people in the future. Like for example, this person, he's an African, very difficult person to handle. මාර ලොකු කටක්, very big mouth, හැමෝ ගැනම වැරදි හොයන කෙනෙක්. ගොඩක් අය යාට බයයි. I was not scared. right? Because the way I spoke, the way I, and Matavada, almost 8, 9 years older than me, right? Very, very senior to me, but I did it because I know I didn't do anything wrong. I had the courage and I spoke. That is my nature. So in the future, he is never going to disrespect me and he's going to think before he talks to me. This is my way, right? So life is all about professional development, is also that how you go out of your comfort zone, right? It's very important. Smart objective is about this 4 thing. This is what you call smart objective, that specificity, reliability. Do you remember, guys? That's that slide. That is smart objective. I think I will show you one. I think you all already know. Yeah, this one. Smart goals or smart objective. Goals or objectives are the same thing. Specific, measurable, achievable, relevant, and time bound, right? Any questions, students, so far up until now? Because we are going to go to the academic writing part. Do you all have any questions? Rifka, anything you would like to add? Taranga, Janaka? Talk, guys. All are very quiet today. Anything? Rifka, would you like to add anything?
No, like when writing about the smart goals,
Mhm.
we can take an example and explain it in assignment as well, no?
When you talk about a smart goal,
No,
can you give me an example, Rifka? What do you mean?
no, that's specific, measurable,
Uh-huh.
achievable, relevant, and
Uh-huh.
time bound.
Yes.
Yeah,
Okay.
right?
I think yes. Yes, good
Oh,
question. Okay, let's go back. Okay, I understood your question. So, for example, here, if you are, but Rifka, what I want you to understand is when you are setting smart goal, you have to mention these 5 terms. But you can give an example related to healthcare sector. So, for example, let's say the smart goal that you're going to set for the healthcare in the healthcare sector for the patient is, let's say, providing the elderly people what do you call, how to say, or providing the pregnant women more iron supplements during their trimester. It's a healthcare professional sector because you're talking about pregnant women, and healthcare sector is now trying to give pregnant women more iron supplements for free in the first trimester. So that is your goal. That is your goal. So how specific is that? How specific is it? Maybe you're trying to give for around 50 pregnant women, right? Measurable. How can you measure? So for example, you will see whoever have got iron deficiency, right? Because usually pregnant women, they tend to have iron deficiency, right? So you will see after giving free supplements of iron tablets, the amount of pregnant women now
is the whether
having
their
a
hemoglobin levels are also high or
high.
in the range?
Yes, you can measure. You can measure it through a blood report. You can see that the amount of cases of pregnant women who are having iron deficiency is low. Measurable කියන්නේ මොනා හරි you can count. You can actually see the value, the figurative value, right? Achievable. By having a lot of fundraising, your own fundraising, you were able to sort of reduce 50 pregnant women. You were able to achieve without any iron deficiency problem, right? Relevant. How can it be relevant? Your goal should be relevant. Like, for example, relevant to all pregnant women. Time bound in the first 3 trimester. This is just an example. Sometimes you can Google search also, like, for example, smart goals applicable for healthcare professional development, right? They might give you an example and they might specify these 5 terms for that example. All you need to do is paraphrase it. Go to Quillbot, copy paste the answer, paraphrase it, give the journal in-text reference, and then that's it. And one more thing, student, that I want you all to add again. Yes, I know that you all have understood about paraphrasing from Quillbot and in-text reference, but also make sure the previous paragraph is connecting to the next paragraph. Like, for example, let's say the introduction is about diabetes. What is diabetes? How diabetes is caused? What are the factors causing diabetes? And then let's say the final sentence of the first paragraph is diabetes has many, what do you call, health repercussion, such as, losing weight, losing eyesight, blah, 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 and you put full stop. Then the next paragraph should be, in order to overcome diabetes, and like that, you have to make sure the next paragraph should connect to the previous paragraph related to the question. අර කතාවක් අපි දැන් ඔයගොල්ලන් novels කියවලා ඇතිනේ කතාවක් අඹයාලුවා කියමුකෝ. I hardly read Sinhala books. I think when I did only Sinhala Sahitya back in my O levels, I used to read and I was very good in writing Nibandhana, right? I really loved. After that, I never got chances to read Sinhala books because I completely got migrated to English, right? But අපි නිබන්ධන ලියනවා හරි මොනා හරි දෙයක් අපි ඔයගලන් පොතක් කියවනකොට you always see right කතාව නිකන් අර flow වේගනේ යනවා පළවෙනි ඡේදය දෙවෙනි ඡේදය first para second para everything is connected අන්න ඒ වගේ තමයි academic writing එකක්වත් වෙන්න ඕනේ ඔයගලන් අර උත්තරේ නිකන් කඩන්න එපා where there is a ඒ කියන්නේ ප්‍රශ්න you can break it into question but try to have an interconnected linkage තරංග ජානක do you all get what I'm trying to say? You all get what I'm trying to mean. Like when you all read a book, you all know that the first, yes, and just everyone, okay, Methni, all of y'all here, okay, Pubudu, everyone, you all just need to know that it should connect to the next paragraph, right? Okay, so we were talking about tools. So first one is you plan, next one is you do, right? It's the same thing. So all these examples, courses, conferences, congresses, all these you do to improve your professional development, right? Then you record. Like samahara velawata, like a musician, 5 years ago and 10, 15 years ago, of course, there would be an improvement in the way he or she sings, right? So how do they know that they have improved? By going through the recordings, right? They will know how their vocals have changed, how the way they sing have changed, the way they interact with the audience, right? So even CPD, you can offer you, let's say them Ugalang English language improve karana kiyamako, like you are trying to improve the way you're speaking. Record yourself how you all were 3 months ago. Record yourself 6 months ago, the way you speak, right? The way you have confidence, right? All that is a matter of, again, you can see it through your recording, right? And this we have already studied, reflection. So students, the answer for this assignment is in this slides. Everything, right, is already in the slide. Again, what I have gained from this activity, how will it benefit my professional development? What kind of impact will it have in my professional practice? Like, for example, my sister, she's a general surgeon in the UK, right? And actually, for me personally, I love science, but it's a field, being a doctor is a field, you have to be very emotionally strong. Samanan, I'm a very sensitive person. And when I worked in a hospital, like I don't know whether I told you this, when I was going on rounds for patient screening, I saw one patient, the nurse was taking the patient's fluid from the spine. අපි කියන spinal fluid ගන්නවා කියන එක. මොනවා හරි යාට එක්ක meningitis හරි. We call it cerebral spinal fluid. That is one of the hell in earth, and I pray to God no one will go through anything like that, because the way that patient was screaming with pain, I think the whole hospital could hear, because that much, it was a female patient. And that was the day I realized I am so glad I am not a doctor, right? My brother is also a doctor, my sister is also a doctor, but I know I couldn't, because I am very, very sensitive to somebody else's pain. Even like if somebody's family is sick or they are suffering, I would cry the most. That is my nature. And at the same time, when I have to, now I can be very tough when it comes to students. When it comes to discipline, I can take control. But when it comes to somebody's physical pain, I cannot take control. I don't know why. That is my nature. But I really love science. So, for example, when it comes to a professional practice, you have to have this thing called emotional stamina, emotional strength. Like holding that grip is also very important. Like my sister, she's very different to me. She can do that, like surgery, cutting, and but one of the good thing is she has a lot of patient care. She does it in a way that She really cares for the patient and she can diagnose the situation also very, very well, right? So even for her, she will reflect from one patient case to the next patient case, like that. She has reflective practice, right? What were the positive and negative aspect of this activity, right? That is also there. Like for example, let's say Ruhuna or Kalani or Japura, there is a ragging that is going, right? Of course, there is a sector of people who don't like to be ragged. And there are other people. I think this ragging nonsense is a bullying. If you ask me, it's a bullying. And it is completely an unwanted, unethical, inappropriate thing that I feel is only going in a country like Sri Lanka. Because I think from the past cases, we've heard how many bad things have happened to the girls, right? A lot of things. So for example, if it's a negative aspect, right? So the people who are doing this kind of thing should know, okay, this is causing a lot of suicidal in people, in university children, making them to drop out from university. Hari, all those things is a matter of reflection, the negative activity, right? That's what I said. Professional development needs to start in as early as possible from your child, right? Of course, we can't tell a child then සාමාන්‍යයෙන් ළමයෙක් chocolate වලට ඉල්ලලා අඬනකොට nobody is going to judge. But අපි chocolate වල ඉල්ලලා අපි supermarket එකේ ගිහිලා ඇඬුවොත් මට chocolate එකක් ඕනේ කියලා, if we cry, what do you think about in a what do you think people will look at us? ඇත්තටම මෙයා මානසිකව psychologically issue තියෙන එක්කෙනෙක්. That's how, because children you can afford to sort of give in, because we know why, because we know a child is low in IQ. They are still developing mentally. But if you at 25 or 30, 35, 40 also cry in the market for a chocolate, you will be judged clearly that you don't have that IQ at that age. That's what people say. I'm not saying that we should judge, okay? Situations are different. Like, for example, there are Down syndrome children. There are actually mentally weak people. No, not that. We don't look down upon them. You will empathize. You will sympathize. You will understand. I know society won't be cruel, but I'm just giving you an example. Professional development has to develop starting at a very young age. Like, you can't expect a child to sit properly or to talk properly or do, you can afford, but you can always train a child how to do it. If you are given off, the first thing is, I was trained when somebody gives you something, say thank you. Or if you do something wrong, you must say sorry. If somebody hits you, don't hit them back. Like, those are things that I was brought up with. And that's why I feel very, how to say, very surprised that I don't see those ethics and values a lot in these children today. Like when I'm a girl, how I should sit is not how the girls in today they are sitting. And for me, it's very disturbing. And for me, I practically see why our parents asked us to do that for a reason. And I don't see that in today's students, right? And it has got into a lot of troubles as well, right? So support this reflection, consider like how will it help you to develop within a year in your career, right? In your specialty, in your professional practice, right? All these students you can talk, but try to relate it to healthcare sector, right? Yeah, all this again. Use competence framework, allocate time to reflect, think about everyday work task, every month, every year. You should take notes. One more thing, Ada kale lamai don't like to take notes. If I put something on the what do you call projector, they all have what do you call iPads and tabs. They take a picture, toots, that's it. Dannet ne samarelato, all these pictures are scattered. Can you see අපි කියනවා ගොඩක් වෙලාවට මේවා ආදි කාලේ දේවල්. හැබැයි ඇත්තටම කියනවා නම් just as much as we have to adapt to today's society, today's technology, I will not deny that some of the good things that we learned back in 10, 15, 20 years ago is really a gem of a thing that today even is actually useful. If you cannot hold a pen and write a proper sentence, and I think that is really a bad sign of your motor skill, right? Because I truly, and because I'm dealing with this era with the millennial children, I really pity them. They don't have anything called the wow factor, that emotional intelligence. Mukut nehelam, like nothing. Apita, like how much we could bear something, they cannot bear for more than 30 minutes. Truly, I'm not lying. Maximum, if I have to teach, is maximum 5 slides that they can hold on. They want a break. But when we grew up, that flipped. That is why, students, I will not lie. Today, the amount of suicides in the West, in the Europe, even in Asia is rising very high. Because these children don't know how to train their emotions, how to train stress. Give me a second. Okay. What I was trying to say is today, because of this lack of development, they are unable to hold on to something for a very long time. That you call the word endurance, right? I don't know what you call in Sinhala. Taranga, what is the word you call for endurance? Holding on for something for a very long time without collapsing mentally, emotionally. I do not know what you call it.
Daragana,
Yeah, there's a nice Sinhala word. I cannot remember that. Dara ganime හැකියාව. Yes, I remember that, but there's another word, but it's okay. Endurance is a word in English we call. They do not have that because of this lack of development, right? So we say professional development might just be how you speak and talk, but no, it is also about the grit, your endurance also, right? I will not define it. මොකද්ද?
Vinda Daragana.
Yes, Vinda Dara Ganima. That's right. Vinda Dara Ganima හැකියාව. Yes, that's right. Okay. Yes. So I will not go back into what is reflection. We already know. And reflective method, you can either talk about the cycle or you can talk about these points. You describe an event, how you made your patient feel. Was it good or bad? Analyzing your area of learning. What is your conclusion? Like I said, if you had a very sick old lady, how did you deal with her? Did you shout at her? Were you kind to her? Did you help her because she couldn't go to the washroom? If you are a nurse, put yourself as a nurse and put yourself in treating an old patient. What is your reflective method? Right? Analysis. What are the, like, for example, if you have to deal with the alcohol situation, you need to know, okay, what are the constituents of alcohol that is bad? What kind of things that can happen in alcohol? You can get liver cirrhosis, liver failure, fatty liver. What are the short and long term? You know, if you are a long term alcohol addict, උදේට නැගිටින්නේ by drinking a glass of alcohol, right? You cannot, like, it's like breathing for them. You start hitting your family, you disruptive behavior, everything, right? Physical, psychological, sorry about the spelling. And what are the alternatives that you can take when it comes for addiction of alcohol consumption? No need to worry about this, right? Now I will go to the next question, and then I will discuss with the academic writing part. And also I think I've already advised you all on your previous assignment, right? So I hope you remember. So let's take a look at because in the second part also there were slides that was in what we are doing, right? Explain the principles of academic writing. So now see, this is your learning outcome task 3 of 3. This will be your final topic assignment for my subject, right? That is to be able to apply appropriate academic conventions in written communication. So you have 3 parts, part A, part B, and part C. So part A, they are asking you to explain the principles of academic writing, right? So before we go to that, right, I will just show you all here. Yes, principle of academic writing, you need to have a clear purpose. The goal of your paper, so you will write a report, is to answer the question you post as your topic. I already mentioned this today. I mentioned it many, many times. if your question is about academic writing, introduce by what is academic writing, right? And you need to give your purpose. Why do you need to have academic writing? Researchers need to know academic writing. Who are the other people who needs to know about academic writing? The most common purpose of academic writing are to persuade. Persuade කියන්නේ අපි කෙනෙක්ට we try to persuade means you try to convince them. Like for example, let's say Taranga has done a research on a drug that can help to reduce heart attack. Now, doing the research is not enough. Taranga has enough evidence that the drug is going to reduce heart attack. But how is she going to convince the world, the people, that this drug is actually going to be good for heart attack? She will start writing a paper. She will introduce about heart attack. She will introduce about the drug. What does this drug contains? What does the drug do? How will it help heart attack? What can it have? What kind of side effects it can have? All that. And she will have data. Like for example, this particular drug, she has taken 10 patients from all Asian countries, India, Pakistan, Nepal, Bhutan, all those countries. And she has said from 10 patients in every country, 7 have responded very well. This drug is very good. Therefore, people should buy. How do you persuade? You actually write an academic paper. You need to know your clear purpose. Persuasive purpose, a persuasive academic writing, even for me students, you all need to persuade me. You all need to convince me that you all have understood what the question has been asked. So sometimes I am not a little bit convinced. I feel like you all have not either understood the question or you all don't write related to the healthcare sector, or some of you all had like spelling mistakes. There were mistakes like purpose. සමහර අයගේ PURPOS එක නෑ E එක තියෙනවා. So imagine what is my situation now. I told you මට අනුකම්පා කරලා ඔයගොල්ලන්ව pass කරන්න පුළුවන්. හැබැයි mom, after I check, it will go through the author and they will check and only they will declare the marks. Samane, I'm very, very lenient with students, even at workplace. Like for example, when I know the child is knowledgeable but little bit difficult in maybe answering exactly, I don't give them high marks, but I will pass them. But if I know the student is clueless, කිසිම දෙයක් දන්නේ නැහැ, කිසිම දෙයක් තේරෙන්නේ නැහැ, වචනයක්වත් ලියන්න බෑ, ඒ අයව I don't pass because I am not doing any good to myself nor to the child, right? So you have to have a persuasive purpose. You need to convince me, right, that you have understood the question, right? So you will choose one answer to your question, support your answer using reason, evidence, and you need to change the reader's point of view. සමහර වෙලාවට additional mark එකක් දැන් මම ඔයගලන්ගේ assignments කියවනකොට සමහර වෙලාවට something that I have not discussed in the slide, maybe you all feel is an additional thing, but related to the topic, if you have included, that is something good. It's an additional evidence that you all are giving, right? Analytical purpose. Analytical purpose කියන්නේ අපි තර්ක කරනවා. තර්කානුකූලව දෙයක් ලියනවා. Analytical purpose, right? So for example, අපි කියනවා then let's say this drug of Taranga to reduce heart attack. She has found analytically compared to the standard drug in the market that this drug has less side effect. How has she proved? For example, this drug person doesn't get headache or nausea or vomiting or diarrhea, but the standard drug that people usually use in the market, they have all these side effects. She has analyzed it. තර්කානුකූලව එයා දෙයක් හොයාගෙන තියෙනවා, right? This is actually what you do in clinical trial. What I did as a researcher, I give completely, I have 50 patients. 150 patient will go to the new drug that we are testing, and the other 50 will be in the drug that is already being used. Any questions, students? Somebody is unmuted. If you have any question, please ask, no problem. Right? So, for example, analytical assignment, often you will investigate what is the cause, what is the effectiveness, how do you solve the problem, right? All that you need to analyze in your paper, right? And informative purpose means you give the information, right? So for example, about risk assessment, you give information. Risk assessment is of 4 types information. Risk assessment can be categorized into harmful, non-harmful, that's an information. Risk assessment in the healthcare sector can be due to needle injury because of HIV patients. That is information. Informatively, you give me answer. Like you give a lot of information, but make sure it is related to the topic, right? So in informative academic writing, the purpose is to explain possible answers to your question, giving the readers new information about the topic. This differs from analytical topic is that you do not push your viewpoint on the readers, but rather you enlarge the reader's view. Like for example, do you all understand the English meaning? Informative and analytical are different. Analytical means ඔගලන් තර්ක කරනවා. මේ බෙහෙත හොඳයි because this has less side effects compared to that drug. That is, you analyze, you argue it out. Informative means when you talk about risk assessment, you just define what is risk assessment. You just give the classification of risk assessment. You just give the types of risk assessment. You just give information and you enlarge, you make it more detailed for the reader, for me. That is all. Anybody has question up until now? Do you all remember how to do in-text reference, in-text reference, paraphrasing, searching journal, all that? Do you all remember? Or do you all want me to show that again? I think you all remember last week when I did, most of you all remember. And I think what I understood was everybody had done like how I wanted, but most of you all didn't write relevant answers and didn't define the question properly. That was what I saw was lacking. But you all had understood in-text reference, and please don't forget to add your in-text reference, right? I already spoke to that student on WhatsApp. I spoke about, I will not mention the name, but I spoke to Mr. Richard regarding this. So what he said was, I have to reduce marks, but if the student has met the learning objective, I can pass the student. So hopefully I will pass the student, but I cannot guarantee that after I mark, whoever marks after me will take you through. But let's hope for the best, right? I really don't want anyone of you all to get failed. That is not my one bit my objective. I don't want anyone to get failed. That is my last objective, right? Audience engagement, no need to worry about it. This one, clear point of view is very important, right? Academic writing, even that with an informative purpose, is not just a list of facts or summarize of sources, which is very true. Although you will present other people's idea and research, like for example, if I ask you all a definition about what is risk assessment, you will find a journal, you will give me the definition, you will put the in-text reference, right? Even though it is another person's idea, right? You also need to give your point of view. You get what I'm saying, students? නිකන් ඔක්කොම ජර්නල්ස් වලින් හොයලා පැරාෆ්‍රේස් කරලා උත්තරයක් ලියන්න එපා. පොඩ්ඩක් ඔයගලගේ point of view එකක් දෙන්න conclusion එකේ. Maybe you can say in the conclusion, we have now found out that in the healthcare sector in the UK, risk assessment can be mitigated. And as a result, and you can say, in my point of view, I also see that if these precautions are taken, we could avoid a lot of risk that is arising in the healthcare sector. Just try to give your point of view also, right? Or maybe you can say, in my point of view, maybe with more research in in reducing diabetic or heart attack, we could prevent these episodes occurring in people who are under the age of 35. Because I will tell you, my youngest patient was 26 who had BP, blood pressure. Youngest patient was 26 when I was doing the clinical trial. 26, a very young patient. The oldest was around 65, 70. 26, imagine getting BP, high blood pressure. Very sad. It happens. Now, heart attack. Some people, age 30, 31, 32, 33, less than 35. Why? Alcohol, no exercise, sedentary lifestyle, all that can lead to these very young episodes of diseases. Okay? Your paper will have and support your own original idea about the topic. This is called the thesis statement and your answer to the question. This is like, you redefining what the question is all about. Who are the people in the class today? Janaka, Pubudu. You all are very quiet today. Do you all have any question?
No, madam.
Okay. Understood, right?
Yeah.
Okay. So second one, part B, you have to submit a piece of your own writing. The writing may have been produced, okay, as a evidence for another unit, but must be in an appropriate format style, following conventions of academic writing. Rifka, can you explain what do you understand from this part B? It's a bit tricky here. It's good that you all joined the lesson today. What would you do for part B? Rifka, are you there online?
Yes,
Yeah.
ma'am, I'm trying to understand the question.
Yes, exactly. So what do you think? Submit a piece of your own writing. The writing may have been produced as evidence for another unit, but must be in appropriate format style following conventions of academic writing. What do you think we are going to do here?
Is it that way we can take a topic?
Very good.
Yes, topic, and we can explain as how it should be done.
So what is the topic you would choose? That is the most
It
important
is
thing. that you need.
regarding health and social care, professional
Very good.
development here.
Yes, Taranga. Yes, good. Excellent. It has to be see the question. Submit a piece of your own writing. The writing may have been produced as evidence for another unit, but must be in an appropriate format style following the conventions of academic writing. It has to be related to academic writing. Yes, well done. That's a good understanding. What is the second point in that question?
It should be in the format of a report.
Yes, format of a report. But my question is, evidence of another unit. You can choose any topic here, student. Either my topic, like it could be the first topic that we did, what we call legislation in professional healthcare, or professional development in healthcare, or communication of Miss Ganguly, sorry, Miss Chammi. I'm not very sure what Miss Ganguly and Miss Chammi are doing for you all, but it can be any topic related to any of our modules that we are teaching, right?
Okay.
Okay, but it has to be academic writing. Like, for example, let's say you are gonna talk. So my question, sometimes now there's a tricky question here. Some of you all can ask me, so Miss, can we submit whatever we wrote to one of the topics that we wrote to Miss Ganguly or Miss Chammi? The answer is actually no, you cannot, because it will be like repetition. But you can bring a topic like, let's say, the importance of, say, empathy and sympathy in healthcare profession. ඔගලම ප්‍රශ්නයක් හදලා academic report එකක් ලියන්න. Like, that's what I'm trying to say. So you can choose, and you will have to make a topic. Maybe you can write the importance of reflective practices in healthcare profession, but don't do that topic because reflective practices is here. You get what I'm saying? You might have to think one topic in any of what we have taught. Either one of the lecturers have taught. You need to create your own topic and then write the answer. Janaka Pubuda Therunada, Tilani, anyone, I think Taranga and Rifka understood. Any of y'all have questions today? Yes. Yes. I think understood. Tilani, what about you? Understood?
Yes, ma'am, understood.
Okay, y'all have understood. Okay.
Yes.
Just
Since all these three parts are of one assignment, now for the part B itself, there will be some kind of a report, you know. So what will be like?
Yes.
Do we have to make it
Yes.
in a like a summarized way?
What do you mean, Rifka? I didn't understand.
No.
Sorry. Can you
this is-
repeat it again?
Yes, since this is the second assignment and you have, broken this into three parts, and first, in the first A, you have asked us to explain what academic writing and the principle of that, and B, you have asked us to choose a topic and do an academic writing on that. Okay, the second part, like the word count for that, how much do you expect us to do it in?
You mean the word count for the question number 2? Is that your question?
Yes, ma'am. Because all three will be part of the second assignment, no?
Yeah. It is the word count 1500, no? It is including second B part
Yes.
also including to the now she is thinking that B is a separate one.
No, total
I'm
it
not
shows
thinking
100 words, no?
So actually,
No, it's not. I'm not thinking it's separate, ma'am. I'm thinking since there are three parts in the assignment, like we have done reports, for 1,500 words. Now, so like since it's a part, one of the three parts, can we make it a little bit precise? Can we make it a little bit summarized?
Okay, so I will answer this question. So just remember, in your task 2 of 3, right? Your word count is actually here for this part 500 words. I will tell you how you divide the word count. Here you have 500 words. Here you have 2000 words. So that is actually the total word count is 2500 words, right? Here one report is actually 2000. So you just write the whole 2000 word count. Now here what happens is 500 word, right? And you have 3 parts. So you can just divide the 500 into 3, right? Maybe you can just write around 100 words about what is academic writing, and the remaining will go to B and C. That's all. That is because you are getting only 500 words for this small section ABC, just 500 words. So
That's
you
why,
can
ma'am,
even,
I asked the part B. So it
yes,
will be in like a nutshell. We will have to write about that topic
300.
using
300, yeah,
yes,
300 words
using
is fine.
right.
Yes,
Okay, ma'am.
yes. So you put, for part A, you put 100 words. For part C, you put 100 words. And for part B, this should be the most amount, I would say, 300. Or you can even put 150 here and 150 here, because in part C, you have to go with a little bit of applying the techniques to review your own academic writing skills. Like what techniques would you put in your academic writing skills? You understand? So, and this is all.
And B is like example, no? Academic
Yes,
writing
yes,
example.
yes. Example. Actually, B is the easiest part. It's just like you take a topic and then you just describe that topic in a report form. Like, but you try to make a question. So I honestly can't think of a question right now, but you can just go through your slides. You can say the importance of mitigating health hazards in healthcare sector. Write a report. Health hazards in healthcare sector. What is health hazard? What kind of health hazard can happen in healthcare sector? What is a classification? How could you overcome? Any topic that is related to healthcare sector, either Miss Ganguly or my one or Miss Chamni, any of us, right? You write a report.
And there we should have to include introduction, body part, and the
But
conclusion.
yes, exactly. Everything will have like a summary of introduction, body, and a conclusion. That is a must. It's very important, right? And then now, like what I'm teaching, the techniques to review academic writing and Harvard referencing, that one is already what I just did in the slide. So for example, what are the techniques you will use? You need to use, for example, clear purpose should be used. It's a technique, right? Hold on, let me go to the PowerPoint mode. Clear point of view, right? Now, for example, single focus. Like, for example, in every paragraph, your paper should support your thesis statement. So here, it is not a thesis. What you are doing here is actually a report, right? Thesis is basically you will do a research, right? You are not doing a research, you are doing a report. Like you already read on what other people have done and you summarize it. Okay, give me a second, I'll charge my laptop. Hold on. Okay. So that you need to think about it. Okay, then there should be no unnecessary, irrelevant, like unimportant or contradictory. Do you know what is contradictory information? Like you trying to bring, okay, UK says that there is no issues happening, like for example, potato. Okay, let's say potato. Many people say potato is a good vegetable, that it doesn't cause obesity. Other people say no, potato is unhealthy, it can cause obesity. Contradictory. Monahari deka, if you have a clashing of point of view or idea, don't bring those information. That's what they're trying to say, right? So, for example, we all know increasing consumption of alcohol can bring addiction or can make you to go alcohol liver failure. We can never contradict that. Overconsumption, drinking 9-10 glasses a day, and within a month the man can die. That no one can deny that it is bad, right? But contradictory when it comes to like potato, tomatoes, like that. Okay, don't bring contradictory information. Logical organization. This is what I always tell. You need to convince me. You need to make me feel satisfied that you have understood what I have taught and what the question is asking about. Academic writing follows a standard organization pattern, right? Each paragraph logically leads to the next one. This word is very, very important, right? Even if they're asking about the risk assessment, right? There will be parts of the question. Now, for example, I will go back to the question here again, right? And I will show you what I'm trying to say. So, for example, here, if they are saying explain what is meant by professional development, yes, you give the introduction, what is professional development. You give example of professional development in healthcare sector, right? And then after that, you can say, in order to overcome barriers of professional development, and there is a link, right? So can you see between the second bullet point and the first bullet point, there is a link. That is why they're trying to say each paragraph logically should lead to the next one. This is something that I have only marked around 4 people's assignments with my work. I have to finish it fast, but I don't know about the other people, but the ones that I marked didn't have that, right? That logically leading to the next one. So the introduction catches the reader's attention. It should provide background information and lets the reader know what to expect. It also has the thesis statement. Now here your statement will be, if it is on risk assessment, it is mentioning about risk assessment, right? And the body paragraph supports the thesis statement. So if you introduce what is risk assessment, your body paragraph should talk about what are the types of risk assessment? How do you classify risk assessment? And remember, connect it to healthcare sector. And then you have the conclusion. You summarize the paper or your report in main points so that this will give you the significance of your paper. So in this situation, you can even give your own answers. You can even give your own understanding that it is actually, my point of view is that it can cause, how to say, maybe with more research we can do this and this. Maybe with more research we can reduce the mitigation of risk assessment. Like that, you can bring in your conclusion. Okay. Any questions? Students, any question? You're almost finishing, you can ask, right? Also, you need to have a strong support. Like every paragraph should have sufficient and relevant support for the topic, sentence, and thesis statement. This support will consist of facts, example, description, personal experience, expert's opinion, and quotations. You can put quotations. Like last time Rifka asked if there is a quotation, let's say of Albert Einstein or whoever, you can put it in quotation. But if that quotation was in somebody else's journal, you give the reference of that journal, not of that author. Rifka, I think you asked this question, right? If I'm not mistaken.
Yes, ma'am. For the last time's assignment.
Yes. Now it's clear, right? It's clear. Now I think it's clear.
Yes, ma'am.
Okay, good. you need to have a very clear and complete explanation. The reader should not have to think hard to understand your ideas, logic, or explanation. Remember, I will not give high grade for using very big English vocabulary. Even for my students, I don't think අර අපි කියන්නේ බරපතල වචන පාවිච්චි කරා නම් වැඩිපුර ලකුණු ලැබෙනවා ඒ වගේ I don't මෝඩ අදහස් I don't go by those stupid ideas, right? If somebody can write in simple but proper good spellings, that is a good write up for me. I don't even like sometimes අපි කියන්නේ even usually our Sri Lankans, they have this mindset. When they go to UK, maybe 2 or 3 months, they have a British accent that even the British people don't have, right? Like, I don't think that is very genuine. You don't need to pretend for who you are not. Eka one nae tamange have your own identity when it comes to writing or when it comes to speaking. Nobody gets extra points just because they use very strong vocabulary or very strong words, because you need to write it in comprehensive, simple English, but needs to be understandable. That's all, right? Effective use of research. Like, for example, one more thing, very, very important. Samahara, I will tell you this, very, very, very important. Sometimes they write this whole paragraph and only last part there is a reference. Only here there is one in-text reference. They write this one complete big paragraph, but the reference is just one for this entire complete paragraph. Guys, please don't do that, students. You need to bring in-text reference. If you write one paragraph with 4 sentences, bring an in-text reference there. If you bring a next paragraph with another 4 or 5 sentences, bring the next in-text reference there. Like, for example, if you take this, let's say this is your first paragraph, bring an in-text reference. If this is your second paragraph, bring an in-text reference, right? Last week, somebody, I think Methni or Thilani or somebody asked me, can you bring similar references to both the first and the second paragraph? You can do it, but don't repeat the same references more than 3 times in that one row, in that one whole paragraph. Or in anywhere of your report, don't repeat the reference more than 3 times. Because sometimes in the same journal, you can find answers for 2 questions. So you will bring that same reference in the first and second paragraph, no problem. But don't repeat it more than 3 times. Students, did you all understand what I said or no?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. Yes, okay. Writing style. Because this is your work, you should use your own words whenever possible. Do not try to write like a boring, overly formal scholarly article. Use natural conversational style that would use in the classroom. But also you don't write like you don't write, I think risk assessment is like this, therefore I think we must do this. No, you don't talk it in speaking language, which I didn't see in most of your assignments, which I was very happy. You all wrote it like academic writing, right? I'm so happy. That's what I'm really, really proud of all of y'all. I know it's not easy, right? Good job for all of y'all. Ada buying duala giye නැති අයට good. I'm very, because I know batch 2 I know will not stand when it comes to academic writing. I think they will run away by the time you come to academic writing. So I'm proud of all of y'all withstanding throughout the 6 months, not running away from the program because of a challenge of having to write, right? Fail වුණත් ප්‍රශ්නයක් නෑ. Like I don't want to fail. No one so far has gone through that, but I'm just telling, even if you have to rewrite and submit again, don't worry. Just, it's a matter of not running away from that fear, right? So congratulations for all of y'all for sticking through right throughout the course, right? So no grammar, no spelling, punctuation, vocabulary mistakes in academic writing. Students, පොඩ්ඩක් ඒක check කරන්න, right? ඔයගොල්ලන්ගේ Word document එකේ right click කරාම you all can see, right? For example, this is not working here, but you can check, right? Your spellings, your grammar, spacing. One more, again, I will not mention names of the students. Your like start is on Calibri. Font style and the size. Janaka, I think, did a good job in that because his assignment was consistent throughout. The font was same and the size of the font was same. Students, please follow the instruction. Clearly in the instruction, it says what should be the font size, what should be the size of the font. Samahara spacing at the beginning of the paragraph is 1.5. After that, the spacing is 2.5. No, guys, I will actually, ideally, in a academic writing, marks are deducted for all of this. Plagiarism, style, font, spacing, margin. අපි කියන්නේ මේකට one word in English, formatting. අපි කියන්නේ formatting. Formatting means everything has to be consistent throughout the report because සමහර වෙලාවට ඔයගලන් copy paste කරන්න ඇති, that's why the font is changing. Right? එතකොට අපි එකට කියනවා plagiarize කියලා. So එහෙම වෙන්නේ නැතුව ඇති. I am just telling you these are things that I had to go through university, all this training. I know you all don't have the same training like I had. That's why I am understanding and I'm lenient about it, right? But I'm telling you at the same time you all are adults. ඔයගලන් O level, A level pass කරා ඊට වඩා තරඟකාරී exams ඉඳලා you all have intelligence. So don't think you all cannot. වැරදි කරාට ප්‍රශ්නයක් නැහැ මේ module එකේ, but don't let නිදහසට කාරණාවක් කරන්න එපා. I don't have experience in this much, so I will tend to make mistake. No, try to improve further and further, right? Try to get what I'm telling you all now so that you do better in your next assignment, right? So please make sure that you do not change your font, your format, your size, your spacing. Once you finish it, අපි එකට කියනවා proofread කරන්න. Do it again. Check whether the size, the font, the spacing, everything is consistent throughout the report, right? You have to. This is choosing a topic is that for that question, you know, like related to healthcare sector, you can choose any of the topic. Like you need to talk about the purpose, the length, all of that in academic writing. Brainstorming. Most of you all have to do this. නිකාන් question එක type කරා, Google කරා, උත්තරේ හෙව්වා, paraphrase කරා, copy කරා, in-text දැම්මා, උත්තරේ ලියුවා. No, don't. What do you mean by brainstorming? කොලයක් ගන්න, ප්‍රශ්න කියවන්න. You write it in a sketch. Okay, the question is about professional development. What am I going to put in my report? Okay, they are asking, what is professional development? Okay, you write it in a sketch. I will first introduce professional development. You give an idea, how many lines are you going to define it in? Maybe 4 or 5 lines will be about professional development. Okay, I will give them in-text reference. Have a brainstorm. Idea එක තියාගන්න. ඊට පස්සේ go back to the question. What are they asking? Why is professional development important? ඊට පස්සේ ඔයා sketch එකක් කරන්න. හරි. What do I do? What journals do I research? What am I going to put? How will I bring that definition? That is what you call brainstorming. I know we try to find the shortest way, easiest way, but remember, if you do the thing properly and at the right way, you don't need to go through that agony of doing something again and again. That's what I asked you, student, brainstorm your exam question. Then especially මෙතන උගන්න පොඩ්ඩක් brainstorm කරන්න තියෙනවා මෙතන, right? Here, you need to brainstorm when you are delivering a report about your own topic. පොඩ්ඩක් brainstorm කරන්න. Academic writing ගැන what topic am I going to choose? What will I put for part A? What will I put for part B? What will I put for part C? Take a pencil and a paper and sketch, brainstorm කරන්න. දැන් ඔයගලන් trip එකක් යනවා නම් ඔයගලන් brainstorm කරනවානේ. හරි ඉස්සරහම මම නුවරඑළිය යනවා නම් නුවරඑළිය is closer to Badulla. Maybe I will go to Badulla also. Hatton is also. You make a sketch and then you make a plan. What is the budget? How will where will we stay? How many people are going? If 10 people are going in the van, how much will each person pool? If the total cost is 20, you brainstorm, right? You make a sketch like that. You do your research. We did that. You also know your statement. If it is risk assessment, professional development, you talk about it, you define it, you stick to the point, right? Planning. This is planning, right? You have to make changes if you have to do it. Go through your notes. You can go through my slides. You can go through your journals. You need to organize, very important. You need to give supporting details, right? And how many paragraphs. It doesn't matter 10, 15, whatever, as long as that paragraph is connecting to the previous one and as long as it's answering the question. Right in the first draft. This I asked you all last week. I didn't get it from anybody. It's okay. I understand you all are covering 3 lecturers' work. First draft, I did this last time. Remember, like in legislation, I told you all to send me a draft so I can give you all a feedback, right? Yes, introduction, body, conclusion, connecting between ideas, right? Repeating words, transition words. Do you all remember, guys, transition words? However, moreover, as a result, in conclusion, right? Therefore, thereafter, transition words. Okay? You need to remember that. Any questions? Students, any questions? Like, for example, transition words is, like I will say, diabetes mellitus is one of the deadliest disease in developed world, and it is causing a death of 2.5 million every year between the age of 25 to 35. Next paragraph. As a result, there is a research that is being conducted to reduce diabetes. Can you see? Transition word. That transition word is linking to the previous paragraph, right? So that is the most important thing that you all need to understand and remember. Okay? And revise, guys. You need to revise. Like, ඔයගලගේ assignment එක දැන් මගේ parts දෙකක් තියෙනවා. Revise. Now, don't think writing assignment is hard. It's hard for me to mark also, right? I'm keeping my 5 days work. සමහර වෙලාවට මගේ break එක වෙලාවේ I'm doing your marking, right? It's not easy. And now batch 2 has come and I will have another set of assignments coming from y'all, and by the time you all finish, then the batch 1 will send their first assignment. So it's like going a cycle, right? So that's what I prefer if one batch finishes and comes to the next batch, because it's a lot of work for me also. And when I write comments, I need to think and write appropriate answers. Then I need to write appropriate comments as per your writing, right? So it's not an easy thing marking assignments also. A lot of things to see. I have to be fair. I have to be standard. I have to be lenient. It's a matter of, balancing a lot of things, right? So revise before you do your assignment. If your assignment is about professional development, go through all the slides related to professional development. If it's about risk assessment, go through all under risk assessment. Revise it. Edit. You have to edit, right? Just because ekapara type kara kiyala, don't think, okay, then you will write. No, go and read again. If you have to edit certain, samara velata, you must have repeated the same word, therefore, for, like that. Can. Edit it, right? Sometimes word count can be more, can be less, right? Depends on the situation. See, check grammar, functions in Microsoft Word, connection between ideas, wordiness, repetition, sentence structure, choice of word, clarity, all that. Lastly, the most important thing, proofread. If you have another work colleague, you can ask them to read it for you, because sometimes you cannot find the mistake, but when somebody reads it, they will find the mistake. Usually as university students, we do this. We tend to give the professor or another professor who is not in charge of the subject to read so that they can give their feedback, how we can improve. It's not easy, students. ඇත්තටම ලේසි නෑ. සාමාන්‍යයෙන් කියනවා assignments, you can even give money and get your assignments to write. Is it happening in university students? No doubt. Honestly, I don't have any idea how people do this. One thing is, as a university student, I couldn't afford that much money to give people to give money and write my assignments. And one other thing is, I'm very happy that I didn't do that kind of thing, because if I had done it, I wouldn't have been able to write good English and write good academic writing. And when I joined Bangkok, I was interviewed by the UK, and I had 15 questions, and those questions were not easy. And the first thing that he said was, I really like the way you had written. You have written very detailed answers and to the point. And actually, when I was asking for the interview, they were wondering whether I will come or not, because I was taking so much time to write proper answers for those questions. I took time, I researched, I wanted to do a good job. And I was the only one who went without any demo classes. They just hired me, because every other person who has to do the teaching for the high school, they have to go through a very strenuous demo. They have to demonstrate and show that they can do it. But for me, no. So that's what I'm saying. හරි විදියට ඉගෙන ගත්තොත් ඔයගලන්ට ඒක ගොඩක් ඉදිරියට ගොඩක් ප්‍රයෝජන වෙනවා. ඒ කියන්නේ it's a skill that will අර ඉස්සර කියනවා වගේ ඕනම දෙයක් ඔයගලන්ගෙන් හොරකම් කරන්න පුළුවන්, but your knowledge, your skill, they cannot steal from you. So if you gain it in the right way, do it in the right way, it will be inculcated in you. It will be there, right? So guys, we are done. This module is over. and you can ask any questions you all have. Maybe we can take a minute because we are already done with the session. Any questions, students? Was this course helpful for y'all? Did y'all gain the whole thing? I think y'all finished with Miss Ganguly and Miss Chammi last week, I think. So I'm assuming that I know for sure you all have gained, because I see a lot of improvement in you all from when you all started in June and when you all finishing now. Any question, Taranga?
No, miss, no question, but I want to thank you giving us
Everyone.
wonderful lectures and not boring one. Thank you so much.
Okay. I'm very happy to hear that. Thank you. Rivka, any questions?
Yeah, no questions, ma'am, at the moment. But what I have to say is, now, as you said, yes, we have learned a lot of things, gained a lot of strengths and skills while doing the course. Because for a prolonged period, I was there with without doing a career and without doing my studies, and I was just a stay-at-home mom. And then when I started to do the course, of course, I gained a lot of knowledge, and it was like I was like not, I didn't have to think analytically and stuff, because it's like a very monotonous way of doing the
Yes.
same routine thing. It
Yes.
changed
Yes.
since I
Yes.
started the course. And you, especially, you were a brilliant lecturer. You were always there. You were asking questions. And even when we were doing our assignments, there were times we were like very confused, since I think most of the students here, they are not university students. I'm not sure. I'm assuming that most of us are not university students. We gained a lot of knowledge because you were, probing us to get the questions, to get the answers from us. We interacted and we gained a lot of knowledge, and thank you for that.
Thank you, Rivka. Thank you so much. It makes me to do more better in what I'm doing. So I appreciate the feedback. Thank you. Pubudu, any questions? I will just talk to all of you all just one last time, because today will be my last day with all of you all. So you can ask or anything. You all can keep in touch with me. I think you all already have my WhatsApp number. So anytime you can talk to me about anything related to healthcare, or what you all want some advice for future, anything, just don't hesitate to talk to me. No problem. I'm there, so don't worry. Any questions, Pubudu?
Actually, I have a question, madam.
Yes.
Still, I am watching videos and refer your documents.
Yes.
Actually, I want to say I am doing this course with a lot of problems, but I am very grateful to thank you.
Yes.
I am remaining the course because of you, actually, I think. That
Don't
means
worry,
you are.
don't worry, Pubudu. I am not going anywhere, even though I'm not going to teach you all. So don't worry. So even in this assignment, if you have problems, don't worry, because I know when I'm marking the assignment, I'm trying my level best to give up. Most of all passed, right? But I just worry that the people who gonna check after me will be a bit strict, because I am very understanding, and that's it. Like even with Mr. Rishad and all, I really convinced that you all should get more time in that first assignment, because I understand, as I always put myself as a student, how it would be. So I think, Pubudu, don't worry about your struggle. You will get there. So if you have again issue, you can message me. Don't worry. You can talk to me on WhatsApp. Ask anything. I will explain to you. Don't worry about it. Okay, don't worry.
Yeah,
I'm happy you stayed.
Yeah, I need to tell you that you are a very wonderful lecturer. That means we are remaining with because of you. That means you are always motivate us that we have to bear some the problems that comes to us, and likewise you always be with us. That means you are the, I think, very great say, lead or something like that. That means you control and you tell us to our heart that we can do, we have to do, we have to do this and that, everything. Likewise, so I am very thankful to you. You are the, I don't have word at that moment. You are a wonderful lecturer, I think. Thank you very much, man.
Don't students, don't give up on your confidence, right? Honestly, y'all are a good set of team. I really mean it, right? So keep the strength and the courage. Any life issues, anything that y'all want to ask, I am always there on WhatsApp. Y'all can talk to me, no problem. Thilani, I think you're the youngest in the crowd, so I hope it will help you because you have got a lot of knowledge and advice. Sorry, Methni, not Thilani, Methni, right? Yeah, is the one.
Yes, ma'am.
Oh, sorry. So you have a lot of advice from us adults, what you can go through in life and face it more confidently, right? So any
Yes,
issues
ma'am.
with assignments or do you have any questions?
Actually, I had many issues when it comes to doing your first assignment. In the second assignment, so I actually I'm going through. I'm referring your notes, but I don't have any doubts. But I also want to thank you that as you are teacher, you did a wonderful lecture for us. And also, as I'm a student, I'm the youngest in this course.
Yes.
So I have gained much knowledge since my childhood. So,
I'm
so
happy.
thank you very much, ma'am.
No problem. That's a good advantage for you. And actually, I learned from a lot of y'all also, like Taranga, like all of y'all. A lot of y'all gave me a good advice about controlling anger. Like I learned from y'all too. So thank you for that. Lumal and Thilani, what about you guys? Have any questions?
No questions, ma'am. But I have to tell something. Thank you very much for sharing valuable things about your life with
Yes.
us. Best teacher I have met.
No
At the
problem,
beginning
Thilani. No problem,
of
Thilani.
I would not be able to do this course, but by the second lesson, I needed strength from you.
Yes.
Hope to health service, as you said, ma'am, in my career life.
Yes.
And thank you for you, ma'am.
No problem,
You
Thilani.
gave
No problem.
experiences and motivation to us.
No
Thank you very
problem.
much.
Keep the motivation students going on. Don't stop from now. Whatever you want to do, now you know you can do it, right? That is all I wanted to do in this course, not just assignments, right? It's all about gaining your, because I know it's not easy to do something in English. I struggle. I have been put down by a lot of people in my life, and I told myself if I become a teacher or a lecturer, I would not do this to my students. So that is exactly what I'm doing to y'all. But I didn't get from my lecturers, majority of them, few I did get. I'm doing it for y'all because I know how much it helps to gain confidence and strength. So I'm happy that y'all have that now, right? Shehara, you have any doubts? You can ask because I know Fayaz usually microphone is not working, so I don't know anything. Shehara, any questions? You can ask anything regarding academic writing or fine. Okay, I think her microphone. Okay. So guys, I guess the others who are unable to speak, I'm assuming. Shehara, you want to talk? Oh, okay, I understood. So guys, anyways, I'll let you all go and thank you so much for interacting, participating. I really look forward to teach you all every weekend, and now it's going to be a challenge to motivate myself for batch 2, but I'll try my best. Bless you all and take good care and keep in touch. If you have any doubts, you can always ask me on WhatsApp. Okay. Take care, guys, and keep spreading good to other people like how I try to help. Just be helpful and lead other people. That's all.
Okay, Miss. Thank you. I wish you all the best for your second batch.
Thank you so much. Thank you so much, Taranga. Take care. Take care, all of you.
Thank you, ma'am.
No problem. Take care. Bye. Take care, guys.
We are
Bye.
going to miss you, Miss.
Miss you all too. I'm gonna really miss all of you all. Don't worry. Take care. No worries. We will be in touch. Take care. Bye. Bye.
Okay, bye, ma'am.
Bye.
Thank you.
Bye.
Bye, man. Thank you so much. God bless you, man.